Okay, well, welcome back to Wisconsin Tonight. It is time for Teen Talk.
More and more teenagers getting their hands on drugs, and that is not good.
Now, we have reported on a number of teen substance abuse-related deaths in the past few years.
And joining us now to talk about this, Dawn Zach, clinical substance abuse counselor at Columbia St. Mary's up at the Ozaki campus.
Correct.
All right, so
Welcome,
is there
Dawn.
a common drug that teens are going to these days?
You know, people really want to know that because we think if we know there's a common one, it helps us treat it better. But the truth of the matter is there are a lot of different drugs that teens use. The synthetic marijuana, K2, is a new thing that we've seen more and more of. But I will tell you, anecdotally, we are seeing a lot of teens using narcotics. You know, the opiates, heroin, pain medications. That's a big thing that we're seeing happening with our population in our area.
Dawn, what are some of the risk factors that people do need to be aware of?
You know, a lot of times when I'm working with people and talking with parents, we like to talk a lot about the protective factors, because sometimes if we talk about risk factors, it makes it sound like there is a certain thing we can do to protect. And you know, there are some things that we can do, but really nobody's risk-free when we start to talk about substance abuse and addictions. With that said, a couple of things that people can really watch for, you know, comorbid psychiatric disorders, so kids that are dealing with depression, anxiety, untreated ADHD, you know, peer group that uses a lot, that peer pressure, impulsivity, which sort of sounds like adolescence. But those are the kinds of things. And then, does your family have a history? Addictions run in families genetically, and there's more and more research to support that.
Okay, let's say a parent gets an inkling that their kid is into something they shouldn't be. What's the first place they need to go for help?
Oh, I would start making some phone calls to some of the treatment centers in the area that know how to work with teens. So we're talking about places like Rosecrans. They have an intensive outpatient program that's just opened in Waukesha. Rogers Memorial. Libertas has an adolescent intensive outpatient program. If you don't know where to go and you don't know where to start, you can start with us folks at Columbia St. Mary's. Just call us and we'll get you directed.
And really, parents just need to be tuned into their teenagers.
They really
Talk
do.
to their kids, communicate. Don't just assume that everything's okay, because it's easy to do that, but it's as pervasive as it is. You have to be proactive about this.
And if parents, they're still the biggest factor. They're still the biggest key factor in making changes with their kids and helping with those troubled behaviors.
Dawn, thanks.
Dawn Zach, clinical substance abuse counselor at Columbia St. Mary's. We appreciate you being with us on Wisconsin Tonight. Important information.